We're in studio with Professor Ahmed Yousef. He is a consultant urologist at Aga Khan University Hospital. Good morning, Prof.
Good morning.
It's nice to have you.
Me too.
As always, usually we start the day off with a quote.
Yep.
And usually it's my colleague Janet. She's not here today, but I'm trying to hold the fort down for her. So I'll share the quote of the day with you.
Okay.
Tell me if it speaks to you, if you agree or disagree.
Mm-hmm.
Today's quote comes from a gentleman called Joel A. Barker. He was a futurist, often cited in African leadership and policy forums. He said, "Vision without action is merely a dream. Vision without action is merely a dream."
I completely agree with him.
Mm-hmm.
Yeah, of course. We have to have a vision, and if we have a good vision, of course, this dream, it will be changed to reality.
Yes.
So vision, planning, in the end, it will be a good thing for the future.
Mm-hmm.
So vision without planning, without working, without decisions, of course, it will be just a dream.
True.
Yes.
All right.
Fantastic. Prof, who's a urologist?
Urologist, this is a doctor who is specific in the male and female urology and male genital system. Urology, this means that we are concerning about the system who is draining urine, okay, and with genital system in men. The urology is dealing with the system draining urine, which means that we are talking about kidneys. We have two kidneys. We are talking about the ureters, which is the tube draining the urine from the kidney to the collective part, which is the bladder. And then it will be stored in the bladder for some time, which is from 2 to 4 hours. Then we can go to the washroom to empty our bladders. So this is the uro system, and the genital system, which is represented the male part, which is responsible for the fertility, keeping the future, and to have babies. So this is in brief what is urology.
I see. So today we are not going to focus on the kidney, bladder, and emptying of the urine part.
Yes.
We are going to focus on the male genital reproductive system.
Good.
Okay. Now, even in our promo for this, we had said we want to talk about vasectomy.
Yes.
And then we talk about male fertility.
Yes.
So before we come to vasectomy, which is like, you know, dealing with fertility, family planning side, right? The fertility of men.
Yeah.
From your practice, and you've been at the Aga Khan University, which also University Hospital, which of course also does research, plus all your many years in this field, is there a concern about fertility in men?
Okay. So let us to start from the basic to be easy for everyone to understand. Really fertility, which is male part and female part. So it is not one part. 50% related to the male, 50% related to the female. So if we are concerned about the male fertility, so we have to have an idea about what is the reproductive system. Reproductive system in male, it is simply formed from an organ which is producing sperm. We're calling it testes. Okay, it's the balls. Every man should have two testes or have two balls, which is performing and forming the sperms. Then through this, we have a connective network. We have a tubes. These tubes should carry the sperms from the testes until to end by the deposition of the semen in the female partner. Then through this way, like when I'm traveling for a long distance, I have to have some stop points, which is gas station, for example, to have fuel, yes, to take some refreshment, to go to the washroom, to have some rest. This is the same idea which happen when the sperm start to take its journey. So we have a network of tubes. Through this tube, there is some stations which is reinforce these sperms to be completely able to continue to finish with fertilization. So we have tests, and then we have a connecting tubes, we have epididymis, vas, and we have what is called the prostate, and then in the end, we have the ejaculation. So this is a simple idea about how the sperm is formed, how it is moved. The second point which we have to know, if the semen is only sperms, this is not right. Semen, it is a component of sperms and a lot of nutrition. which is help the sperms to be healthy and motile until to reach to its job, which is fertilization of the ovum. So it is important to know that there is a combination of organic and somatic and psychological factors affecting the issue of the fertility. Of course, there is no fertility without good erection. So if we have to speak about the erection or fertility, both of them, they are the same subject. Okay, so all this started from the higher center of our brain, which is sending some impulses to the genital area, and then the process starts. Erection will start, and in the end, it will end by ejaculation. So simply to have an idea about the fertility, so we have to speak simply about the sexual performance, and then we'll end with the fertility. Sexual performance, mostly it is formed from 4 stations. The first station is the desire, that the interest to practice. If the male doesn't have this interest, it indicates that he has some disease, which it should be treated. After the desire, it is started to transfer to a nerve impulses, and then he will get an erection. If he didn't have erection, this means that also it is some diseases. We are calling it erectile dysfunction. After that, he has to have what is called ejaculation. And this is the main idea or the main target of the sexual intercourse, is to have the ejaculation. If he doesn't have ejaculation, also the disease, many diseases in these issues also we can treat.
Right.
And the 4th step is the orgasm or the satisfaction, which he is feeling. So also if there is no satisfaction...
Those two are different.
Yes.
Ejaculation and orgasm are different.
Yes, completely different. If it is not there, also this is a disease. Okay, and it should be treated. So this is the 4 parts of the sexual performance for men. Then, if he started the sperms, now it is transferred to the female partner, so to start the journey inside to reach the ovum. So the sperm is formed from 3 parts. From a head, this head, it is containing the DNA, the male character, and then it has a body. This body, it has a nutrition subject, this is the engine, and then it has a tail. This tail which is directing the movement. So the sperm, it is the package, like the DHL package. It is the package, which is carrying the target, yes, which is the DNA, to move it to the female partner. The sperm, when it is formed in the testes, it should be well nourished and matured. Through this journey from the testes until to be ejaculated, this is the way which is moving, and in each point, each station, there is some fuel, there is some nutrition, okay, to make it completely active. So the first step in the fertility issue is to start to check the semen test. We are facing usually in our clinics that the male is a bit shame to come to the fertility clinic. He's feeling that is something affecting his
manhood.
Yes. So usually, culturally here, usually the trip started by the female part. And she is starting to go to the physician, and then when she is okay, he asks her, please tell your husband to be examined. And this is, we found that the male, it is very difficult for them to go and to be examined, which it should be obsolete. Why? Because male is consisting around 50% of reasons for the fertility. So it is a couple problem, not a person problem.
Yeah.
When we have a patient in our fertility clinic, of course, the first thing you have to ask him, number one, about his sexual life. He may be okay, but he's not continuously acting with his wife. Of course, all of us know that the ovulation time is only 3 days. So the lady, she is liable to have a baby or to be fertilized only 3 days in the period. If they don't have the intercourse through these days, whatever they will do after that, it will be not productive. So number one, understanding is very important. Number two, lifestyle changes is very important. And then we're starting to do some investigation, which started with the semen analysis. In the semen, we are seeing many, many parameters. And according to that, we start to see where is the problem and how we can treat it. Many problems, it can be a reason for affecting the fertility for men, starting, of course, from each step. There is some diseases in the testes affecting the fertility. There is some diseases in the vas, seminal vesicles, affecting the fertility, in the prostate, and even in the end organ. So all this, it should be examined. So this is for the fertility, how we are thinking, and what it could be the pathway for treating and for diagnosis.
When you think of how to perhaps approach it from a patient standpoint, when would it be a cause of worry? Because when we were discussing, the female reproductive system, it's a matter of course, time, age, but then it's like, okay, if you've tried to conceive for this long, so when should it be a worry that there could be a fertility issue for a man, for a couple? Let's start there.
Okay, so it is not like the female partner, it is assigned to a time of the age. Okay, so for men, it is not like that. Whatever the age, he can have a baby. It is not related to the age. You can see some men, they have babies when they are 90s, 70s, even 100, they can have. So there is no time limit. But it should be, of course, have some good erection to transfer the semen from the male part to the female part. The other issue which is important for the male is understanding. Why? Because the definition of the fertility or of the infertility, it is inability to conceive. They cannot have a baby in spite of regular sexual life intercourse. Okay? It is not affected by anything for a year, 1 year. So if there is a continuous sexual life for a year, this means that, and they couldn't conceive through this time, now we can tell them that you have what is called infertility, and you have to be examined for that. Nowadays, we started to see the young people, they are a bit hurry to have. When there is 1 month past, 2 months, 3, they started to seek for a medical advice. This is, by the definition, this is not infertility because the time limit is 1 year. But we can call, if it is started more than 6 months, we can tell it is a delayed fertility, but it is not an infertility. So by definition, it should be after 1 year. Yes. So the visit for the male part, the male part, when we come to the clinic, of course, number one, we have to take from him a good and deep history. For example, if he has a previous marriage, we have to know in this previous marriage, he got a babies or no. If he has a good sexual life, if he is on any treatment, okay, if there is any previous operation. Was something which is important, and it may be missed from many colleagues, that this patient, he had a history of what is called undescended testes. Undescended testes, it should be the testes, it should be in the scrotum, in the sac, by the age of 1 year. Okay, if it is not in that time, of course, he should be delivered or that, but we can wait up to 1 year until to be in the sac. If not, it should be brought down to the sac. Why? Because if it kept not in the sac for more than 3 years, that it will mean it will not perform sperms. So in
And
surgery,
is this a case for both testes and descended, or it could be one as well?
no, there is many cases could be bilateral undescended testes.
Okay.
Yeah, and also this gave the case more difficult. Because the testis is not only a manufacturer for sperms.
Yeah.
It is also producing testosterone, which is giving the male character.
Okay.
So this is very important, and I think this is one of the most important points which our gynecologist and the pediatrician, they have to check the baby and to be sure that the testis in position in the sac. If not, they have to announce this to the father and mother to tell them your baby should be followed by a pediatric urologist because this is very important point. It may affect his future. Okay, so this is the first point, which you have to have a very deep history from the male partner. Of course, you have to revise with him some medication which he's taken, okay, because there is some medication that may cause what is called retrograde ejaculation. Retrograde ejaculation, this means that he is not ejaculating. Everything is okay, but the semen is not coming out. The semen, instead of coming out, it is go back to the bladder, and it come with the urine after that.
Because of some medication?
Some medication, some procedure, it can cause that also.
Okay.
So this is very important to seek with him.
Okay.
Also in our history, which you are taking from the patient, how old is his wife? Because when the wife age start to increase, this means that the possibility of conceiving start to decrease. So the age of the wife is very important in the history taking. After that, of course, we have to do for him a complete physical examination,
Right.
which is started with to check his secondary sexual characters, his beard, his mustache, the male shape. Of
Right.
course, this is very important for us.
Why?
Okay, because this means that his testosterone level is okay, which is mean that yes, we can expect that his testis is functioning. This is not a complete clue that he is okay, but of course, if we have that this male character, this indicates that it is a good sign. And then, in the end, we'll start to ask him for some investigations. The first part we are asking about is the semen. To check. We have many parameters in the semen we are checking. Number one, the amount of the semen.
Amount in volume?
The volume, yes.
Okay.
Volume is very important. It should be more than 1.5 ml. The second thing, of course, is important is the count.
Right.
We have to check the number of the sperms. And here you can imagine for something which is very important, that the normal volume is more than 1.5 ml, and the normal count, it should be more than 40 million sperm per ejaculate.
Wait, let's start with the volume.
Yeah.
So below 1.5 ml,
Yes.
there's a concern here.
Yes.
What is the average volume of semen per ejaculate?
It should be more than 1.5 ml up to 3.5 ml. Okay?
1.5 to 3.5.
Yes.
So how do you know that? In terms of a teaspoon, is that half a
Yeah.
teaspoon?
No, I will tell you the importance of this if you have a problem. Many people, they don't have this volume, but they have a good sperm count, and they never feel that they have a problem. He has 5 children, so he never ask about that,
Yeah.
and they never concerned about that. But for us, if it is lower than that, and this patient is complaining from infertility,
Yeah.
for us maybe give a reason that there is some sort of blockage or obstruction. So this is the value in the diseased person. But for the normal person, of course, he will not come.
Okay.
So for him, it is not an issue. Yeah.
And then you said the sperm count is how many per ejaculate?
It should be per mil. Per mil, it should be more than 15 million, but the whole ejaculate should be more than 40 million.
How do you measure that?
Yeah.
They are measuring this under the microscope. They are counting them. There is specific ways to count them. Now there is what is called automated sperm analysis. This is a machine that is doing everything, okay, and it giving all the data about the semen test.
Okay.
The wondering thing here that we have 40 millions. They are start a race, all of them, until one of them, the most powerful sperm,
Yeah.
to reach to the ovum and to do the fertilization. So we can see this is election of the first or the most powerful sperm. And this is which is keep a healthy baby. Start the race with 40 million and then
finish with
one will reach. Right. And I will tell you 40 million, this is not the common. The common is 100 million, 200 millions, 300, you can find that per ejaculate. But this is the least. If you are more than that, more than 40 million, this means that you are in the normal range. But more than 95% of population who is fertile, they have more than 40.
More than 40 million.
Yes.
Thinking through the quality of sperm and what factors determine the quality of the sperm.
Yeah. Okay, so what is the quality? You are meaning with two issues. Number one is the motility, okay? Because the sperm, as I told you here, it has an engine.
Yes.
So it should move. And by the way, the distance which is the sperm is moving, it is very, very long.
Yeah.
Okay, because he's moving a lot of distance inside the male part through the epididymis. Is a very long tubes, and then the vase, and then it will go to the female part and it moves. So it is a very long distance.
Yeah.
So it has
on average, that's how many kilometers?
Is it kilometers?
Because you're saying it's a very long distance to travel.
It
and
is,
if you think about it, 10 million and it's only one guy who will be arriving at the end.
I will tell you, I hope that we have some diagrams about the testes. We have what is called seminiferous tubules. It is a very long and it is very small and very tortuous. And for this, the sperm has to pass all this distance, and then he starts. The shortest distance in the female, it is around 3 to 50 centimeters. But the long part in the male, because it's traveling a long distance.
Okay.
Yeah. So number one, it has to be a motile sperm. So if I have a healthy sperm and it is not moving, I don't have any benefit for it.
Okay.
So we have to have, it should be around 56% of the sperm should be motile, moving.
Okay.
And this sperm, it should be in a normal shape. If the sperm is not in a normal shape, it will not be able to conceive.
Okay.
For, as I told in the beginning, the sperm, it should have a head, body, and
The tail.
If, for example, it doesn't have body, or it doesn't have head, or it has two tails, for example, this means that it is in abnormal shape. This is will not be able to fertilize.
Right.
So this is the male parameters which you are checking. There is many issues, other issues about the reaction, the pH, and the bust cells. There is many, but this is the main parameters: the volume, the motility, the number, and the shape.
Okay.
And accordingly, you can know that yes, this patient has 40 million sperm, but actually the effective amount is 10% or 50% or whatever the percentage. And accordingly, we start to have the plan for management and further investigation.
Okay.
Yeah.
And what were, like I was asking, what factors influence the quality of the sperm?
Yes, this is a very good question. Why? Because many of us, we don't know that the sperm should be in a good quality. If we can imagine the testes, it is not like the ovaries. Testes, it is outside the body.
Yes.
Yeah. So why it is outside the body? Because the optimum temperature for the testes to work and to produce sperms, it should be 2 to 3 degrees less than our body. And for this, all the males, they are finding something very strange, which is in the cold weather, he found that the testes coming up. And they come to the clinic. I found that my test become smaller. It is not like, but it is become up because to be closer to the body, to maintain the temperature.
Okay.
And in the hot weather, the reverse will happen. It will go down.
Okay.
To be away from the body, to keep the
cooler.
Yes.
Okay.
To keep the temperature 2 to 3 degree low the body temperature.
Okay.
So, in the other hand, if the temperature of the testes increased, this will start to make some difficulties in producing the sperm. The sperm, it will not be in the maximum quality. And the most important disease we are facing in this issue, what is called varicocele. Varicocele, this is a disease which is common. Okay, this varicocele, it is affecting the production of the testes. How this happen? You know, in any organ in our body, it has an artery giving it a clean blood,
Right.
a healthy blood, and then this blood start to do the work in the organ, and then it changed to unclean, unhealthy blood, which it should go back to the heart to be cleaned. So the drainage system in the testis, if it is affected, okay, in this time, this unhealthy blood, uncleaned blood, start to be stagnant around the testis.
Okay.
And then what will happen, the temperature will increase. So the tests will not work in a good performance.
Yep.
So this is one of the reasons which make the testis the test not working in the optimum situation,
Okay.
which it will affect the production of the sperm.
All right.
Yeah.
Let's get into, so this is one half, which is dealing with fertility.
Yep.
Interventions, before we talk about now vasectomies, which is the other side, let's talk about interventions that can be made in the case of infertility. So is it surgical, is it lifestyle, is it, I don't know, medication, yes, psychological.
Yes, so as I told you in the beginning, fertility, it has many, many reasons.
Yes.
Okay. So of course we have to be sure that the patient is sexually okay. He can perform. Okay, if he can perform, that's okay. We'll go to the second step. What is the reason of the infertility? But if he cannot perform, we have to solve this problem first.
Yeah.
Okay, so this is the first important thing. So of course we have to exclude that this patient, he doesn't have any erectile dysfunction.
Right.
Okay, if there is erectile dysfunction, of course it's important to treat it, because this is the bridge.
Right.
Okay, to transfer the sperm from the male part to the female part. Okay, so if there is no any issues related to the erection, now we'll start to see what is the problem in the causing this infertility.
Yeah.
So as I told you, we have to start with the semen test to check, and from the semen test we can know some keys about what it could be the problem. For example, if we found the volume is a bit low, it gives us a clue that maybe there is some blockage, so there is some tests we can do it. If we found that the sperm quality is not good, the volume is okay, but the number is not that much, the motility is not okay, the shape is not okay, this gives us maybe there is some varicocele. So if we found that the sperm parameter, it is not in the optimum condition, we are asking the patient to do some ultrasound,
Right.
okay, and also to do some hormones, okay, because all this system, it is controlled by the hormones.
Yes.
And the hormone parameters, it is important to check how the balance is going. Okay. And this is really a very important point. I want to advise especially Gen Z who's starting to go to the gym, and when he's going to the gym, just start to take some anabolics, which really it is very, very important to avoid. Why? Because this is giving the body an external androgens. Okay. When you start to have this, it will affect the internal testosterone, and of course it will do what is called a negative feedback mechanism, and it will affect the issue of the spermatogenesis. And
Anabolics are, like in layman's language, is it protein? Is it?
yes, it is proteins, but in some points they can have what's called androgens. Okay, so
steroids essentially more, is it close to a steroid or more of a protein?
it is proteins.
Okay.
Androgens is proteins.
Okay.
So why it is in the ingredient of the proteins for? Because it is do muscle bulking. So he's taking this to have this bulk. Yes.
Yeah.
Okay. But the problem when we start to take these anabolics, okay, it started to, now you have an exogenous source. So the body will start to stop his internal source.
Right.
Okay. So, which of course it will affect the issue of the fertility in the future.
Right.
Okay. So if he has to be sure that this component doesn't have any of this component which it can affect his fertility in the future.
So you've talked about ED.
Yes.
Dr. Ari, there was a time last year when government pathologist Dr. Johansson Dorr wrote an article. I don't know whether you came across it. It was doing the rounds. It was even covered in the news, where he was raising concern about what he's seeing. People dying because of abuse of erectile dysfunction drugs.
Yeah.
And you're saying this is a concern. Well, are people getting them? A number of the people who are using them are people who are in the age where they should not be having ED problems. Is there a rise in cases of erectile dysfunction in Kenya?
No, it is not in Kenya, it is worldwide.
There's a rise in ED worldwide.
Let me to tell you the percentage of erectile dysfunction, whatever the degree, it is around 70% of male.
What?
70%.
70% of men?
Yes.
At what age? You know, maybe age now.
Yeah. It is, it is from the 30s up to 70s. But it is not severe degree, whatever. Why? Because if the patient, as I told you, that the performance, sexual performance, it is 4 stages. If the patient has loss of libido, for example, we are considering this some sort of erectile dysfunction. If this patient has not good erection, we are considering is a weak erection or erectile dysfunction. If he has a rapid ejaculation, he has delayed ejaculation, he has an ejaculation. So also this is a degree of erectile dysfunction. If he doesn't feel the orgasm after doing the intercourse. So it is not mean that weak erection is weak erection. Weak erectile dysfunction is mean that he is not doing the performance in a good way.
Optimally.
Yes. So this is it is a high percentage.
So at some point in their lives, men between 30 and 70 will have some form of erectile dysfunction.
Yes, because why? I will tell you another form of erectile dysfunction. Imagine that you have a problem, financial issues. You have an issue with your manager tomorrow. Of course, you cannot perform sexually. So clear mood is very important. If your mood is not clear, this is some sort of erectile dysfunction, because the cycle will not start. You will not have the desire.
Desire does not kick in.
Yes.
Okay.
So
a mental block.
Yes. So starting from the higher centers, the psychological issues, ending by the ejaculation, it is a big circuit, it is a big line. So any point in this, it may affect the sexual performance.
Okay. Let me try and thread it. I keep raising this issue because psychiatrists and psychologists have said that we have a case of a crisis in mental health.
Yes.
So with high mental health cases, are we saying that therefore we are likely to see high erectile dysfunction cases?
Of course.
Because mind, not starting the engine, nothing will happen going down.
And also he has many issues. I will tell you that to have a good sexual performance, you have to have a good mood, a good environment. You feel that you are in a rest. The problem that many of the mental people, they are in a hurry. He's fast running to the meeting. Tomorrow early morning he has to go to his office very early in the morning. Afternoon he has all these meetings, and there is a lot of problems. So when he go to home, he will find that, no, I'm not feeling well. Really, I want to sleep. I want to revise what I am doing. Even he doesn't have a time to make himself relax. All this, of course, will affect.
Okay.
Yeah.
Let's get into vasectomies now.
Yes.
I think they've been around for a while. They're getting more common here, especially with younger men. Talk to us about vasectomy, what essentially the procedure does, and then let's debunk a few things like reversibility and all of that. But let's start with what essentially is a vasectomy.
Okay. So in the beginning, we talk about the male genital system.
Yes.
Okay. So the manufacturer is the testes, and we have a network of tubes. The main tube, which is carrying the sperm, we are calling it is vase. And this is the name of vasectomy camp, because we are cutting the vase.
Right.
So, of course, the vasectomy, it is an easy procedure with a great effect, very, very great effect. And many patients, after doing the vasectomy, they regret and they're asking themselves, why I did it? For this, we are not encouraging young people to think about vasectomy, except in a very restricted conditions. Okay. For example, we found in our practice there is 3 types of people who came for vasectomy. Number one, a young guy came emotionally affected and broke from a failed relationship. So he decided to go for vasectomy because I will not have any baby from any other lady.
I'm done with this relationship story.
Okay. So, and he's come very agitated, he want to do vasectomy. And when we're asking him, what is the reason? And when he's telling them, I'm asking him, okay, so ask this question to yourself after 5 years. Imagine yourself after 5 years. You found this was a good decision to do it or no? This emotional time, it will take some time and then it will subside. Of course, we are not advising these people to go for vasectomy because they will regret why I did this for myself. Why? Because vasectomy, we are doing it as a physician to succeed.
Right.
So we are doing with the way it will not come back again. Okay? So the reverse of vasectomy is something very difficult.
I was about to ask that because there's the other narrative that you hear, which is that vasectomies are reversible. So it can be essentially a form of birth control. Yeah.
So
and then
let me tell you, in the best centers and best hand, the success rate for the vasectomy reversal is 20%.
Oh. In the best.
Yes, and this is the highest rate. Okay, so when you are doing vasectomy, we have to give all this information to the patient. The second type of the patient who's asking for vasectomy, they are asking about financial issues. He has one baby and he is not afford to have another baby, and he's thinking, no, I cannot go for another baby, so I wanted to have vasectomy. Also, this person, after 5-10 years, he has money, his life is okay, and they start to regret what I did it. I need another one. For this, we have to explain to them what you want. If you want to have a family planning, okay, we have many ways. Because there is family planning for male and for female. And generally, there is some what is called reversible and irreversible. The reversible one that I can control now for whatever the time, okay, and when I have or I decide to have, it is easy. I will stop this method so I can have a baby, okay? And the irreversible, it is once and for all.
Yeah.
I will do it and it will be for life. So for male, the reversible one, it is a bit not many, okay?
Okay.
Like to have isolation, to have the condoms, all this, and really the satisfaction for this is not that much high. Most of the men, they are not satisfied with these methods. But for the female partners, we have many methods. We have patches, we have injections, we have tablets, we have IUDs. There is some hormonal methods and non-hormonal methods. Okay, so all of this, it could be reversible. When you decide to have baby, you can do that.
Just stop.
Yes.
Okay.
The irreversible ways, okay, for male, of course, it is the vasectomy, and for female, it is the tubal ligation.
Yeah.
Okay. So if we go back to the male vasectomy, we are doing it as a physician, by the way, it will not come back again.
Right.
Okay.
Let me.
But then,
Yeah.
we are talking about the success rate for reversal of a vasectomy is
Yes.
around 20%.
Around this.
What's the success rate of a vasectomy?
99.9%.
Like for real?
Yeah, it is. Yeah, it is.
So
It is
vasect-
very high.
So one and
Why?
done.
Why? Let me
it's a,
tell
you're
you.
saying there's a low chance
Yes.
of
It
somebody
is,
who has
but
undergone a
very low.
vasectomy
And
to actually end up conceiving.
Conceiving, yeah.
yes. Why? Because what we are doing, you can imagine we are cutting a part of the vase, okay, and we are burning the tube inside, okay, so to prevent any chance to regrow again and to recanalize, okay, so to reconnect again, okay, it may be a bit difficult.
To be a miracle.
But there is an important point that it is not mean that when you are doing vasectomy now, this means that we will be sterile now. Because still there is some sperm in the tubes.
Right.
And yes, in the seminal vesicle. Okay, so of course we are telling him, nearly in the first 24 ejaculation you may have sperms.
Okay.
Okay, so you have to have another way of isolation, of contraception for this time.
Or of emptying the sperm.
Yes. And there is
okay.
there is some people, they may have a sperm even up to 3 to 6 months. Okay. So it is not an immediate action.
Okay.
Yeah.
We'll talk about perhaps how to, what would I say? Not even the mental process of it all, of a vasectomy, and how to deal with that. But I wanted to get into some ethical issues,
yes,
and especially on the doctor's part.
Yes.
So with women who seek tubal ligations, especially younger women,
yep,
physicians will often advise against it or straight up refuse to do the procedure.
Yes.
You've also said in younger patients, you highly discourage.
Yes.
And from a medical perspective, I get it. Then there's also the question of just autonomy. People who have, made up their minds and they are sure that they want a vasectomy. Where do you stand on that from an ethical perspective?
Really, of course, I'm not advising anyone to go for vasectomy, because as I told you, it is a simple procedure with a very great effect. Every patient is speaking about himself, he's seeing only himself. But we are seeing many patients, and we are seeing how many patients that regret that they did this vasectomy. And really our job is, before treating patient, we have to advise patient. So we're telling you, you are sure? Yes, I am sure. Okay, please go and do some family discussion and come back to me. If he came back to me, you are sure? Yes. Okay, so let me to explain to you that this is the steps, and you have to know that to have a baby, it will be something very, very difficult. Please go, read in the internet, do some research, and come back to me. Okay, and then please bring your wife. Let us to have a table discussion, all of us, about that. Okay, so what we are calling it is taking him to the cold area, make him a prolonged, maybe he will change. So the pressure, it may be changed. Sometimes he will change or he work his mind.
Okay.
So the other question is, because Mariam is asking about the body autonomy. If I have come and I've made up my mind, it's my body, I want a vasectomy.
Yeah.
Give it to me.
Okay, so if this is a decision, really, is really also a difficult question. Because, it is something like, if you have a child, okay, and he likes to play a lot, he don't like to study, and he's insisting to play, and he doesn't see the future.
It's his decision to play.
Yes. Yeah.
No, the difference between a child and...
I will come to this point. I will come to this point. So we have to keep the fact that maybe the patient is not seeing the whole image. Okay. So it should be clear that this is what he wants, which, by the way, it is always come from a pressure. Okay, from other, no one he likes to do vasectomy, but the problem is the pressure from outside. So we have to shoot. I will tell you which patient we can think he is a good candidate for vasectomy.
Okay.
This patient is an old guy, okay, 50 plus, and he is a bit worried about that if he has a young baby, how he'll do, how long he will live, and take care of him. Yes, we can think with this guy. The money is not a problem. Emotionally, it is not a problem. He is just thinking about how can I save this baby if he come now. Okay, I can think with him. He's a good point to discuss. But mostly, patient with emotional issues, or this is, of course, we will not be happy to help them to do this, because if he will come back again to have a baby, it's something really, it is very, very difficult. And he will struggle.
I see the emotional.
Yes.
I see the emotional dilemma here, Mariam. You are the medic and the professional. And you're treating many patients, and you can see a bigger picture. And you're disconnected from this person's situation. So you have to walk the journey with them to make sure that they are completely certain that this is it. And that can be at 2 minutes.
A one and done,
It can be a one and done. So you have to walk that journey with them. True. Right? So then, Doc, we see some facilities advertising and saying, we have 1 week of vasectomy, clinic, like they're doing camps.
Yes.
So this week is a vasectomy camp, come one, come all, and let's conduct these vasectomies. What do you say about those?
This is as I told you, when you have any patient for any operation, not vasectomy, we have to do what is called informed consent. Informed consent, it is a very important, and it is a cornerstone in our practice. Informed consent, I have to tell the patient what is the case, what is the advantage, what is the disadvantage, what if he do this procedure, what if he didn't do this procedure, and what is the alternatives.
Yeah.
Okay, and of course we have to give him a time to think about that. This is what we call it is an we cannot touch any patient without this informed consent.
Right.
But to do it as a camp, I think this is something I cannot comment on that, but it's something very difficult to push all the people, all the men to go for vasectomy.
Okay.
Yeah. Promoting it like it's a screening. It's a screening camp.
Like it's a dental appointment.
Yeah.
Like, get your teeth cleaned.
How invasive is it? Sorry,
No.
How invasive is the procedure itself? So when you say you're doing a vasectomy, right? How do you get to the tube?
No, the procedure itself, it is very simple, by the way, because the tube, it is outside the body, so we can feel it very simply, and the procedure, it is 15 minutes.
Okay. 15 or 50?
15.
Whoa.
1.5, yes.
5 minutes.
Yes, 15 minutes, and then it is done.
Yeah.
And it cannot be done under local anesthesia. It is something.
Okay.
The procedure, as I told you, is a simple procedure with a very great effect.
15 minutes walk in, 15 minutes walk out, go home.
Yes.
Walk out?
Yes.
Or wheel out.
Or wheeled out.
Close enough.
Yeah.
I'm thinking through the psychological aspects and the psychological stigma around vasectomies.
Yes.
From a cultural perspective, people are associated with, what would I call it? A loss of manhood. I don't know what other better way to put that. So then how do you educate patients who may want a vasectomy? They may be in that age, they may be good candidates, but they don't want to essentially feel like they're losing
They don't want to
their
be
manhood.
unsullied.
Yeah.
No, vasectomy, it will not affect any man performance. This will not affect the erection, it will not affect the sensation, it will not affect the orgasm, it will not affect
Testosterone
this.
production?
It will not affect all that. Just what it will be semen minus sperms. And also you will ejaculate and everything.
Right.
Okay? But of course, as I told you, the history is very important. And when you are, for example, you have a patient who he wants to have a vasectomy, and you find his age is 45 and his wife is 42. So by logic, their chance to have baby is very, very low. So we have to tell him why you are going to by this, the chance to have baby is very low.
Maybe you only see one wife. But I see what you mean. It's a dance. It's a game of
Yes, it is.
one understanding and of course trying to make informed decisions and have people make informed consent.
Yes.
I'm thinking about the popularity of vasectomies growing. Is that a good or a bad thing from just a birth control perspective?
No, what I'm telling you, to think in the future, this is a good issue. To plan for your future, it is a good issue also. But you have to choose the right way. Okay, for us, let me to tell you, if we have a patient, for example, he has a heart disease. This patient, we're starting with him with some medication. For example, if he is not responding, we are doing for him what is called the minimal invasive. We are doing for him cardiac stent. Okay, if he is not responding, now we go to more invasive and open heart. Nearly this is all the disease in our body.
Right.
We started with the simple issue. If it doesn't work, we go to the minimal invasive. If it doesn't work, go to the major issues.
Right.
So why you have to jump to the major issue from the beginning?
Right.
Yeah.
So explore the...
Yes. So there is another options.
Yes.
We can try.
We can explore them.
Yes.
Let me talk about couples who are, for example, certain that they don't want children.
Yes.
Birth control is an option,
Yes.
but except birth control comes with side effects, especially for women. I hear about a male birth control that's being worked on, but
Yes.
not here yet.
Yep.
For women, it's side effects through and through, risks of DVT and strokes and so many other things, hormonal fluctuations. So it's like, okay, why not? We're sure we don't want to have children. Why not have this 15-minute minimally invasive surgery done on the man?
Okay, so this is what I am telling you. There is some indication we can do vasectomy. For the other example, the wife, the doctor told her you cannot be pregnant again. You have something in your heart, you have another disease, you cannot take anesthesia, you cannot continue your pregnancy. In this, yes, we can think that maybe it could be one of the solutions. Okay, it is not only not the only solution, but it could be one of the solutions. Okay, so we'll go the same. If the simple issues doesn't work, we'll give more to the minimal invasive, and then we'll go to the vasectomy. It could be like that. But if you imagine this, what is the percentage of this?
Probably very few. Yeah.
So this is the issue. So we have to think logically. Which is first, which is second, which is third.
Okay.
Prof, we thank you very much for coming today and for all these lessons. Please accept our invitation next time we call you.
Thank you so much. Thank you. Thank you so much.
Professor Ahmed Yousef is a consultant urologist at the Aga Khan University Hospital, and has been here talking to us about vasectomy, about male reproductive health. We've picked a lot of lessons. We shall have him again tomorrow. Tutakuwa ground.
Tutakuwa ground. We love a Friday ground. That's exactly where we'll be. Thank you for spending the morning with us. We are really appreciative. Tupatana kesho 6 to 10 a.m. From myself, Mariam Bishar, Eric Latif, Janet Mbugwa in absentia. Asanteni, tupatane kesho.